Hello, my name is Sierra Newman and I'm a registered nurse. The presentation that I have for you today is the Capstone reflection video for healthy heart intervention for elderly patients who have hypertension. Hypertension is a serious complication of the cardiovascular system, which involves the force or pressure of blood against the arteries' walls. This condition is also referred to as the silent killer because there aren't any noticeable signs or symptoms. According to CDC, hypertension can lead to other health-related problems such as heart disease, heart attack, or stroke. Cardiovascular diseases are the leading causes of death in the United States. This dilemma definitely does leave room for improvement on the behalf of the population. It will involve further education and reinforcement on the behaviors of the individuals who are at risk. Healthy People 2020 lists one of the key determinants of health as individuals' behaviors and the fact that this is related to the development of health-related complications. Non-pharmacological options for management include the implementation of dietary approaches to stop hypertension, also known as the DASH diet, also physical exercise, and also home blood pressure monitoring. For this assessment, I have been working alongside two individuals to observe and gather the appropriate data to enhance their overall health. I had the pleasure of gaining insight from another registered nurse who I consider the subject matter expert. During our session, we discussed the topic of hypertension and what it means to the patients that are in her population. At the end of the session, we determined that an intervention was necessary to promote healthy lifestyle behaviors. The patient that I observed is a 70-year-old widow female. She resides with her oldest daughter and her son-in-law. She is very independent and can attend to most of her ADLs with minimal assistance. She was diagnosed with hypertension over 13 years ago after her husband passed away from a stroke. She's currently taking 2 medications for blood pressure management, which she has been compliant. Based on the additional questions I was able to obtain from the patient as well as her daughter, I was able to detect a biological history of hypertension. Next, I will show the contribution this intervention is to the family satisfaction and the quality of life. The Healthy Heart Care Plan included the implementation of the DASH diet, exercise, and the usage of the home blood pressure monitoring. This intervention was discussed in the form of a PowerPoint presentation to the patient as well as her daughter. I came prepared with printouts of different food suggestions from the DASH diet, along with home blood pressure cuffs for demonstration and return demonstrations at the end. The patient did seem very appreciative of this printout, and as a matter of fact, at the end of the presentation, she actually put the printout on her refrigerator because she said she wanted to keep that as reference for the future. Exercise is another thing that we discuss as one of the key components to preventing muscle fatigue, which this can lead to falls and injuries and other complications in the future. So exercise would help to keep the bones and the muscles up to par as they should be. So incorporating all of these things would definitely be beneficial to the patient's health overall. Next, I will describe how the use of evidence-based practice and peer-reviewed literature was used. So one of the key things that I pointed out is the change in the guidelines for what is considered the pre-hypertensive stage which is according to the American College of Cardiology, American Heart Association Task Force on the Clinical Practice Guidelines. These changes include the following: elevated, or what used to be prehypertension, is no longer 130/80, but it is now 120 to 129/80. And the hypertension stage 1 is 130 to 139/80 to 89, compared to the previous guideline of 140/90. This information was extremely useful to address the new guideline that is considered the prehypertensive status. During this stage, it is now encouraged to make necessary modifications in the lifestyle adjustments or lifestyle changes. This evidence-based practice alone was something that I had discovered during the research, and it was actually new information to me. It was also new, of course, to the patient and her daughter as well. Next, I will assess the degree to which successfully leveraged healthcare technology in this Capstone project to improve the outcomes. One source that is utilized is the blood pressure monitor that is kept in the patient's home. The American Medical Association has validated a list of home monitors that are considered effective. Other technological resources that are available and were mentioned are through the usage of artificial intelligence, such as Alexa or Siri. This technology can be used to set reminders for medication times, appointment reminders, as well as notifications for local fitness classes. Now, due to this patient being elderly, it really was not her preference to use her phone or any other electronic device for things like this. She preferred to keep track of things by handwriting them, and I let her know that was perfectly fine to continue with how she feels comfortable with, because that's what works for her. We did, however, have her verify, or rather I verified on the website of Validate BP, just to make sure that the blood pressure monitor that she was using was in fact certified through the American Medical Association, which we did at that time. Next, I will explain how health policy influenced planning and implementation of this Capstone project. So the Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, is a federal law that is used to protect patient-sensitive health information from being disclosed without the patient's consent or knowledge. During the COVID-19 pandemic, the U.S. Department of Health has allotted HIPAA flexibilities, which have allowed providers usage of everyday technology for virtual visits. I use this as a guide or talking point for the patient and explain to them the benefits of telehealth and telemedicine, which can be used in the future if needed for virtual visits. Next, I will explain whether this Capstone project outcome matched my initial predictions. I think this really did meet my predictions and my expectations as well. I felt well equipped and was able to effectively communicate to the patient and her daughter. I presented this information concisely so that they could understand. They did have follow-up questions towards the end, which I encouraged and welcomed, and I felt comfortable answering those questions and providing them more resources to the things that they were asking for me. So in my opinion, the entire presentation just went well. It was more like a long conversation of things to help them improve. And lastly, I will discuss my own personal growth during this program. So throughout this journey of RN to BSN, I have learned so many things that I view as preparation to leadership roles and positions. I now have a better understanding of the importance of policies and procedures, ethics and communications, as well as the benefits of using a collaborative approach to advance the healthcare experience. I have specifically grown in the area of looking at various literature and evidence-based practice as a guide to improve certain problems within healthcare. In a professional setting, I can definitely see myself using the things that I've learned about how to properly research possible interventions to many of the dilemmas that we face today. The part that I particularly enjoyed through this process was putting together the PowerPoint presentations and the brochures and actually going out into the community and teaching these things to the people. I learned that I like teaching and preparing, so that's something interesting. So in essence, I take this entire experience as a stepping stone in my career of nursing, and I look forward to continuing my educational studies. So this does bring me to the end of my presentation. Thank you so much for this opportunity. Thank you for tuning in and listening, and have a great day. Bye.